Are you aware that families are falling victim to deceptive practices in the hospice industry? In recent years, California SMP has seen a notable increase in hospice fraud complaints. About 25% of total SMP complex interactions involve deceptive hospice enrollment. In fact, as a result of two 2019 reports from the U.S. Department of Health and Human Services Office of the Inspector General, California has placed a moratorium on new hospice licensing since late 2021. Hospice fraud occurs when Medicare is falsely billed for any level of hospice care or service. Fraudulent individuals may entice patients with offers of free items such as TVs, recliners, groceries, gift cards, cash. In reality, they are taking advantage of their Medicare benefits and fraudulently enrolling them in hospice. An analysis of senior Medicare Patrol case data from 2023 showed that the hospice fraud victims who reach out identify, for the most part, as Hispanic or Latino. Witnessing numerous instances of this fraud, the California Health Advocate Senior Medicare Patrol, in partnership with strategic collaborators, California Hospice and Palliative Care Association, and Inland Caregiver Resource Center, initiated a project to improve resources for Hispanic and Latino individuals with limited English proficiency. Our goal is to help them access accurate and current information about hospice care, empowering them to make informed decisions and avoid becoming victims of hospice fraud. Through community listening sessions and research, we discovered widespread misconceptions about hospice care, general confusion about end-of-life care options, and uncertainty about where to find accurate, reliable information. In response, we developed marketing materials aimed at educating the general public on 4 key topics. What is hospice? How to recognize a hospice scam? The importance of discussing end-of-life care, understanding informed consent. Our primary message to patients and their caregivers is clear. It is important and necessary to plan for end-of-life care. Talk about how you want to be cared for with your family, or ask your family how they want to be cared for. When you are informed about end-of-life care, you will be equipped to notice hospice scams. How can you help us spread this message? Patients and their caregivers often seek information from trusted sources, and you may be one of those trusted voices. By understanding end-of-life care options, developing empathy for the challenging experience families are navigating, and building trust, you can help patients and their caregivers to feel comfortable asking questions, make informed decisions, and avoid fraud. This is especially true for families navigating language barriers in healthcare. We took special care in developing our marketing materials in Spanish, particularly when addressing the term hospice. We chose to use the word hospice instead of hospicio, which means a place where terminally ill people are taken and not hospice care. This ensures clarity for the Spanish-speaking community, as it's the term commonly used by hospice providers and those committing fraud. All the details of our process findings and the marketing materials are compiled in a toolkit designed for professionals who are in contact with individuals who may be eligible or are looking for information related to hospice. This toolkit, along with the associated marketing materials, are available to you at hospicefraudprevention.org. We invite you to join us in our efforts to combat hospice fraud.